Welcome to the Sacred Window podcast. I'm your host, Christine Devlin Eck. Here at the Center for Sacred Window Studies, we explore and expand on conscious postpartum care. We navigate the overlap of caring for others and caring for ourselves. We honor the transitions, not only in giving birth, but in being alive. Welcome to the conversation.
And I will never be the same again.
Welcome to the Sacred Window podcast. I'm Christine Eck. I'm so happy to be here with a new connection of mine. Meaghan Beames is from Toronto, Canada, and she is a craniosacral therapist. She has created, not only does she do this in a private practice, but she's created a program that trains others in how to offer this specifically. I think it's really specifically for women's health that you use this therapy, and we can, kind of move more into that. But I was immediately drawn to Meaghan's work because craniosacral therapy for me was a really notable part of my postpartum experience, really from the get-go, and we can also talk about that. But Meaghan is teaching this in different parts of the world as well as in Canada. She works with families locally, and she is an incredible trainer for professionals. So this is a really great topic for the Sacred Window podcast because amazingly, we don't have any content on craniosacral therapy here yet. And this is a really special conversation for me to have for so many reasons. But Meaghan, thank you for being here.
Thank you so much for having me. I'm honored to be your inaugural uh, guest on Craniosacral Therapy. I hope I'm not the one and only. And I hope to be back too. I
Yeah,
love sharing about this.
I already feel like this has to be like a series because there's so much here.
Oh, yeah. Days. I could speak about it for hours.
Well, to begin with, because I have a feeling there's folks listening that have not experienced craniosacral therapy. They don't have a frame of reference for it. So can you give us a little bit of an intro to what this is?
Yeah, absolutely. So craniosacral therapy is a very long word, I realize, and probably difficult for a lot of people to say. Right off the bat. But so craniosacral therapy, it works with the whole body, not just the cranium and the sacrum, as you would assume based on what it's called. So it is a very gentle form of hands-on body work where we release tissues within the whole body that could be keeping us stuck in certain areas. And when our bodies are stuck in certain areas, our self-healing capabilities are limited, especially in those areas. So when that comes to, let's say that comes to your organs, well, maybe your organs are tight. They are muscles or they are surrounded in fascia and they can become tight themselves. When they're tight, they might not work super well. You might not be digesting foods well. Perhaps you're limited in what digestive juices you're even secreting, right? So you might not even be able to break down food in your digestive tract. And so when we release these areas, we're also releasing the nervous system because fascia is tissue specifically that we work with. Um, Fascia contracts, but it doesn't release very well. So when it contracts, it stays contracted. So in that contracted state. So it um it stays tight for years and years, depending on what happened. So what we do is we release that fascia. It surrounds the nervous system. It surrounds the organs. It surrounds muscles. It surrounds bones. It surrounds itself. There's layers upon layers of it. And and we're able to really gently guide it into releasing rather than forcing it into releasing, like some people might do with, let's say, fascial stretch or rolfing or just stretching in general. Um, we suggest it to change. we share with it that it is safe and that it has completed its job and it's no longer needed. It's able to move on from that job that it completed, say 15 years ago when you fell out of a tree or fell off your bike. And we're able to help these body systems to function optimally or to function the way that it was designed to function, barring any genetic disorders, of course, but um, we're able to really just help that body to heal itself. It's wonderful.
What I think is so interesting is, we come from this sort of medical culture where like, we often just will ignore things until it becomes like such a huge problem. And then the the way that we approach sort of correcting those problems often requires, things that are pretty invasive, and what I love about craniosacral therapy and this whole concept of like looking at healing differently, looking at like not even just choosing to look at it, but recognizing that the body actually knows what it needs. And it just like what happens when we actually approach things with like a gentle guidance almost of rather than like a forceful
Exactly.
correction. There's just amazing intuition that like the body knows what to do. And so it's these practices that are so much more gentle are actually, and there's lots of research about this too, that gentle touch is so much more effective in so many circumstances than
Hmm.
any kind of very hard or forceful pressure. Um,
Hmm.
yeah.
Now, what I would say is that not everyone's way of healing is through gentle. Some people prefer that harder touch. And so craniosacral is not for everyone. Sometimes people get really anxious. That generally is a sign that what we're doing is working. If the person who is receiving cranio is anxious, that's usually a sign that we've actually got a good spot and we should hang out here for a little bit. Um, but it's not everyone's preferred form of healing. Now, on the contrary, what I would love is that perhaps it might not be your preferred form of healing, but if it could be used in conjunction with your preferred, it's a wonderful foundational way of pairing the body to heal. Yeah.
Mm, mm,
So, and something that I love to say is that craniosacral therapy isn't everything. It's a lot, but it's not everything. And what I think is a wonderful thing is that craniosacral should be should, I hate using the word could be, could be the first step, and then we are able to do all of the other things after, like movement, stretching, strengthening, acupuncture, um, you know, maybe even adjustments. But first, telling the body that it's safe to let go, and then you can do the other things. Because sometimes what I've heard from a lot of people who do use those forceful things is that, they're good for a little while, but it just always comes back no matter what. It always comes back. And to me, I think that that's because the fascia was never given a chance to, and fascia is incredibly wise. It is very, very smart. It was never given the chance to feel safe enough to let go. And what it's holding on to are memories, stories, emotions, protection, uh, fear, usually. And when this tissue that is incredibly smart is told what to do, it's like, hang on, no, 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 no. I know what to do and I'm doing it currently. Thank you very much. You can all go away. So once it's told, okay, you're in a safe space, you can find a different direction to move in. You can find ease. Uh, it generally responds really, really well. And we are able to find things in the body that could be from one's own time spent in utero. Like these things are deep, deep, deeply ingrained in our being, in our body, in our posture. It could be you know, an episode that happened when you were 5, something where you got really, really scared and you got really, really tight, and that tension and those stories and that fear is still stuck there. Perhaps you were in a car accident when you were 15, when you were 25, yeah? And now you're 40. It's still there. It is still there, and it's still having an effect on your body. So, craniosacral, instead of telling the body, "Okay, well, I see this, I'm gonna do this," it says, "Hey, body, where do you need me to go first? What do you need me to do with you today?" And every session is different. Every session, we're gonna find something different. Every session, we're going to go somewhere different. And you might come in saying, "My shoulder really hurts," but your therapist, your craniosacral therapist, goes to your hip. And you're like, "But it's my shoulder." And your craniosacral therapist says, "But your body is telling me it's your hip. So I'm gonna go there." And guess what? 3 days later, your shoulder doesn't hurt anymore. So we go where the body tells us to go, not where the patient or the client tells us to go. Because that's usually pain is usually a story that your body's telling you to be like, "Hey, pay attention to me. I am in pain." And that area of your body has lots of blood flow. It's got lots of neural connectivity to your brain. The part that's not that's tight does not have great neural connectivity to your brain. It is tight. It is stuck. So it's not going to talk to you because it's the stuckest. It's gonna talk to us because it's the stuckest. Yeah? And I know that stuckest isn't a technical term, but we're gonna use it today.
I love that. It is so fascinating. It's so
Yeah.
fast. It's like, and going back to something you said that really struck me is, when some people don't prefer light touch, but it's
Yeah.
like there is no one thing that is the everything. It's like it has to
Exactly.
be anything we do. It's sort of like, looking at the sort of the philosophy of more ancient systems of medicine where, approaching health comes from all these different directions. It's this whole identity of healing, which involves our food, it involves what we do every day, it involves different areas that our specific body is going to need aid and balance using different things. And so, I love how you are really framing and helping us to understand that, craniosacral therapy is that sort of basis that gives the body permission to be impacted and healed using all of the other things that we're doing.
Mm.
I mean, I think we all can agree that, we can undergo a treatment or take a medicine or do something, but if we're not supporting that in all the other areas that allows our body to actually access that action, that we won't experience the relief or the shift
Yeah.
that we need to change. Um, yeah, so I think that I mean, my personal experience with one of my home birth midwives was also a craniosacral therapist. And so I
Amazing.
was super lucky because I had never heard of it before, but she would talk to my body when like during my prenatal visits, and she would, because it was a home birth midwifery practice, I got to have like hour-long visits. They weren't, a super quick 15-minute check-in for prenatal. It was luscious and really loving. And sometimes they'd
Mhm.
be at my home when it got closer to the birth. And so I was able to experience it. And looking back and thinking about it, to me, I remember being kind of curled up on my side and I was supported with all the different, padding and pillows that I needed. And it was like I experienced it as like a warmth, like a vibration, and then just like tremendous relief, you
Mhm.
know, particularly in my hips, because that was what was really carrying the strain of all that extra weight. And I had pretty big babies, so I definitely was like larger than I had ever been. And but tremendous love and calm and immediate impact for sure to my nervous system. And I've been thinking about this a lot, like what is that invitation that the body, that the mind, that the whole being receives when we experience touch in very intentional ways. And a craniosacral therapist, like you've mentioned, and I just said about Kristen, is she was literally talking to my body, like
Mhm.
silently, but I could sense the communication that was going on. And it blew me away because, I didn't know what my body needed, but she was able to do that. And for the period of time where, the childbearing year is so unique in so many ways, like our bodies need different things that they did than they did before traditional, there's a million different modifications to everything that someone needs to adhere to in pregnancy and postpartum. But craniosacral therapy remains steadfast. I mean, why is this such? I mean, I can answer this, but I would love to hear from you. Like, why is it such a perfect fit for people in this childbearing year?
I would say because your body is a sovereignty, and we respect that. We respect it as it is. And there aren't too many modalities that say, you tell me what I need to do, right? A lot of them are like, oh, this is your issue. I'm going to do this and force it into it. We listen. And when we're listening with our hands, with our intuition, with our minds, with our heart, whatever it is, we are being guided by your body. So we are always doing, well, if it's a good therapist, we are doing what your body is asking us to do. And and so it sends your body, your tissue, your essence, your being, your soul, your whatever it is that you want to use will send us messages, and we'll receive it in ways of maybe we might look, or our eyes won't ever be able to to look away from a certain part of your body. And that usually is telling us, okay, well, we got to go to your left ankle. Or sometimes some therapists will get visions. So we'll get like we'll see either the event that happened in the area of your body that we're touching, or we'll see the area of your body that we need to go to. We might actual feel physically where your body feels the tightest, and we'll go there. We might even get our own little messages, like sound, like voices, to be like, don't forget about their nose, you know? And so we're constantly checking in with you and your soul, your being, your body, your and if you believe your spirit guides, uh, to do what you need us to do. We are serving, purely serving you. And I mean, how many other modalities have that as their one of their main intentions that they set?
Hmm. Yeah, and I think, for the postpartum window, which of course is really the center focus of what we're doing here at Sacred Window Studies, it's so impactful because everything is subtle. Everything is like blown wide open, and the person is able to take in like so much more than maybe we would at any other time because everything is just ripe for reception. And that's
Yes,
really hard because any
very vulnerable.
very vulnerable. too much, too hard, too fast is like immediate overwhelm. And so I'm curious, like when you work on postpartum women, is like do you get things quicker and more easier than you would with someone not in the postpartum window?
It depends on the person, and it depends on my relationship with them and our rapport. Some, they are very closed off. Some have had extremely traumatic experiences, and they're not ready to be open to those things. And and so again, I am constantly checking in with that person to be like, is this too much for you? We're not There are some places where it's like, oh yeah, you really gotta get in there and make sure you release everything, get that somato emotional release. And again, a good therapist would say, let's just dip our toe into that. And maybe we'll just completely take our toe right out. So sometimes that body isn't ready. And then other times we might have a rapport built where it's like, I feel their emotions. They let everything go. They cry on the table. And again, I'm checking in with them to make sure that this is okay. And they're like, yes, it's like pure relief, right? So it depends on the person. It depends on their experience. But one or the other is not better.
Yeah.
They are both healing, very incredibly healing experiences, especially when someone who has perhaps their bodily autonomy has been breached, and then they're able to say, no, I don't like that. And you respect it and you back off. That in itself is incredibly healing. So I think that it's important. It's important for everybody that has gone through giving birth, uh, whether it's vaginal or cesarean. Both are incredibly strenuous on the body, very taxing on all of the nervous systems, because especially cesarean section, that is an intense abdominal surgery, and it's not laparoscopic. These are not small incisions. This is huge, major abdominal surgery that's cutting into deep fascia, uh, um, muscles, nerves, lymphatics, everything. And then sewn back together, now we have scar tissue. So it's one of the only modalities where we can go in and very quietly and gently and non-invasive, um, promote healing in that area. There's other things that are very non-invasive, like energy work, or even like a TENS machine to stimulate. But this one, because it comes along with human touch, the human touch in itself is, and it's usually, well, not always, but it can be skin to skin, but um the human touch aspect is very wholesome for most, and healing in itself.
I think too, like some, immediately postpartum, oftentimes people they don't want to receive a full body massage yet,
Mm.
you
Mhm.
know,
Yes.
and even Abhyanga, which, is also very gentle. It's gentle pressure. It's so important to have that gentle pressure during those first 6 weeks. And yet, even that, some people just aren't quite ready for. And what I experienced with craniosacral is that I was craving that. And Kristen would always use that word like unwinding. I was
Yes.
craving that unwinding because I had been through so much physically and I really couldn't do much at all. Like even, you know, moving my body to the bathroom was really hard. And so to be able to be touched and given that therapy in the most physically vulnerable time was a better choice for me than receiving an Abhyanga at that time. And she would come and, she would do it right on my bed. So I didn't necessarily even have
Mm,
to, but I think that's notable too. It doesn't have to be on this massage table. Seems to me like it's such a flexible modality that we can meet people exactly where they are, exactly where they're comfortable. And that to me feels like part of the safety. It's like, what position are you safe in right now? What position helps you to feel in a receptive place that you can take this in? Um, yeah, and I wrote down like your body is a sovereignty, because that, like, leading with that question of what do you need right now? How do you need to be? Where can I come to you? Um,
yes.
that is all an essential part of the process in making this work.
Yes. We have to meet them where they are. And if they are, and I mean, I do have people come into my office and lay on a treatment table, but if we are able to meet them exactly where they are, like they are at home where they are the most safe, a lot of times there is a better experience that way. I mean, and that goes without saying, mostly because, finding parking, walking when you don't feel comfortable, things. But, uh, but to actually just be in your bed where you do feel the most safe, and that usually, um, then your body is really able to let go. And that unwinding that you speak of is fascia, right? And especially if you've had a 30-hour labor, just think of how tight all of that fascia is, the fascia in your shoulders, the fascia in your abdomen, the muscle, your uterus, um, your pelvic floor, your thighs, like your butt, everything is so tight and everything is connected from your toes to the top of your head. So when we use Cranio, just because our hands are on your ankle doesn't mean we're not having an effect on your hips, your legs, even your throat. We're able to place our hands in lots of different areas and have an effect on lots of other areas that are not underneath our hands specifically. Yeah.
To be honest, like, as I'm listening to you, I'm like recalling the sense, like I can feel the different parts of my body, like having that memory of
Mhm.
what that unwinding feels like. It's almost like just, which actually brings me to a curiosity that I had earlier today when I was thinking about this conversation is, you know, there are times when we don't have our craniosacral therapist there, or like we don't have an appointment. And I am always so interested in practicing on my own, like whatever it is that I can do to help create that space of bodily sovereignty and safety. And like we talked about before, like there's so many other things that we can do, but when, like, are there ways that we can experience that unwinding on our own without a therapist there to do it for us?
Yeah. So there is, and uh some people, our body is constantly finding or trying to find ease. It is always. So if you were to place your hands on your thighs and very just really gently, and just listen into what your thighs are doing, what's going to happen is you'll find that your hands kind of get drawn in different directions. And you're like, oh, my one hand feels like it's turning in towards the groin. Oh, but my other hand is going down towards my knee. That is unwinding. That is our fascia. Maybe not necessarily unwinding, but that is the fascial strain pattern, let's say. That is the pattern of movement that our fascia is used to doing. And it will loops, however many times. It'll loop. 50 times a day. There's no science on this, so I'm just making up numbers, but it might loop once a day, and it's just a constant, this one, direction, then the other direction, then the other direction. Now, what happens is that fascial strain pattern might not be serving you any longer. And if it's not serving you any longer because it was an injury or a surgery from 15 years ago, what you can try to do is encourage it into ease. And so what some people will do at home is just they can like shift their body, and then once you get to kind of an end range where you're like, "Oh, it doesn't feel like it wants to go that way," go the opposite direction. And you're like, "Oh, it goes this way easily. Oh, now I'm kind of at an end range, right? Like, so I'm rotating my body a little to the left. Oh, I'm at the end range. Okay, what happens when I do a little back arch? Oh, that feels nice. Oh, but it makes my body kind of want to move a little bit diagonal down to my right hip." So this is finding that ease, and that is an unwinding. You can do that in your wrist. You can do that in your ankle, your legs. Whew. I just had a deep sigh. So whenever I do an unwind and I actually release an area, I will sigh. So as I was telling you what I was doing, I was actually moving my body and telling you exactly what I felt in my body. And I have students who have told me where they were like, "Oh, I was driving the other day and all I wanted to do was like uncurl my shoulders, um, or my left leg was just going like internal rotation, external rotation, bending." And so it's just listening to where your body wants to move easiest. Um, and that is not stretching at all. It is the opposite of stretching. Yeah.
It's so cool because I'm just always drawn to practices where it invites us to get really, really close with ourselves, like
Hmm.
really actually listen. Because I, spent the first 25 years of my life not actually listening to my body at all, like just kind of going about life without having any close relationship to my tissues and all of the things and the processes. And it wasn't until studying Ayurveda that I realized that I was my best teacher. Like I was the one who could teach me this the best. And I just had to get really, really quiet and listen. And so as I'm watching you, do that, yeah, it's like, it's just listening. It's
Hmm.
listening so intimately that our movements are just a direct result of what we hear, what we sense in our own body. And that's a practice that I can imagine, and, for sure, for me, would have incredible benefits. In that practice, we get better at it, I'm sure. I'm sure
Absolutely.
the more you listen, the quicker the response becomes. It's so beautiful. I would love to know a little bit about, I've watched my newborn babies receive craniosacral therapy from Kristen, and I would cry when I would see her hold
Mhm.
them. And I can feel myself like welling up with tears now thinking about it, because it's pretty and like it is intense what babies go through to become.
Absolutely.
And of course, there are so many different stories of what every one of us has our own story of what our birth was like. And so to see a baby being given this treatment is so profound. And I'm just curious, yeah, just talk about what it feels like to do this for a newborn baby and what you notice. And because for me, I felt like the babies were just so open, just so ready to receive it. But I can also imagine that based on what our stories are, like you said, we each have a different story, and some people aren't ready to open to that. So I'm curious if babies follow that pattern as well.
They do. There are some who have been through incredibly traumatic experiences. Um, and or just like a lot, you know. You just hear the story of their birth and you're like, that's a lot, you know? And depending on how they felt about it, because they are sentient beings, they have emotions, you know, they have the full range of human emotion in that tiny little being of theirs. They don't know how to express it. They don't know how to share it, but they are capable of feeling all of the feelings that we as adults can feel. And depending on how they felt about their birth and perhaps who handled them at birth, they might not trust other people. They might be very closed off. That's very few and far between, I would say. And a lot of times they are older. So older being like 4 months when they've got a little bit, they're capable of stranger danger, let's say. The younger they are, a lot of times the more open they are. And they're only just coming into their body, like their soul is only just entering, perhaps not even fully attached yet. So it's a very physical thing, but it's also a very spiritual thing where we are talking to the physical body, but then also inviting in the soul, right? Like saying, "Hey, we see that this body that you've chosen to enter is having a difficult time. We see that, and we want to help this body to function properly, including the digestive tract, right? Reflux sucks for everyone. Um, and so it's kind of this, it is very much like, okay, your body's not working, let's help you. Very physical, but then it's also very spiritual. It's very much very grounded in healing, but also grounded in love. I hold these babies as if I've known them forever, and I love them. I love them almost immediately. I don't know what their names are, and that doesn't matter. You know, their name is marked in my calendar, but I don't need to know what their name is to love them as much as I do. And and to feel compassion and sympathy, really, but mostly compassion for their experience. And when they're because they are sentient beings, they when they feel like they can trust you, right? I do have to let them know that I am trustworthy. When they feel that they can trust me or the practitioner, they generally let go very easy. Um, but it's a dance. It really is. It's so because their physical form doesn't have years and years of built up tension. That does release very well. That does very well. But if they did have perhaps a really long pushing stage, they don't release super well. Maybe they were stuck. Maybe they had a compound presentation. Maybe they were in the NICU for months. They're going to take a little bit more time. Maybe they were stuck in the same position. They were breached. They were transverse. They were OP for weeks and weeks. Their physical body is gonna take a lot longer to see the relief, to see the changes than it would be as if this baby was in a great position, they were born really easily, and maybe they just had a nuchal hand and their, you know, their head is tilted to one side, just a smooch, you know? And so depending on their experience in utero and their birthing experience, it can either be really, really quick that we can see changes or take a while to see changes.
I feel like in, those of us who are working with, and I feel like craniosacral therapy, along with, a number of other more subtle energetic types of body work, it's very feminine. It carries a lot of that beautiful, sort of subtle, warm, just like invitational, um, passive flow that carries such incredible depth and potency, but on a different qualitative level than, other types of healing. And so when I work with in that, I feel like the postpartum window, like all of that kind of describes aspects of that on a subtle level as well. And so you've mentioned like it being a spiritual experience as well. And I think for me, I can, pinpoint moments in time where there has just been such a notable moment of connection and impact between myself and a client, or noticing like a really potent shift that happened for them in their process of recovery. And I'm wondering if you would mind sharing a story that comes to mind for you of sort of a transformation that happened from someone that you've worked with because of this deeply beautiful divine feminine practice.
I mean, out of thousands of people, it's hard to pick one, but I guess there is one where, this was a baby who was about 3 months old, who had he was OP. Um, this was a year ago, so I might not get the whole birth down, but I believe OP pushing was many hours, and then tried forceps vacuum. Neither of those happened, so cesarean. Um, and these parents, they brought their baby to me, and they were thinking, oh, he's doing well. He's not quite meeting, the 3 month developmental milestones, but we're just struggling with feeding, right? We're just topping up with a bottle. Now, for me, I saw this baby, and I'll do a visual assessment to be like, okay, I'm seeing that perhaps their cranial bones are shifted in a way that their craniosacral rhythm is probably not great. And um, there's a side preference, there's a bit of flattening at the back of the head. And so I I did some work on the cranium, and the feedback that I got 3 days later was that not only was he feeding better, which was what they were there for, he had more awareness, like, he was awake. They said it felt like he had come into his body. Before, when he looked in our eyes, it was like, "Yeah, there's a baby there," and now there's a human. Like, there is a soul that's looking back at us, and that was within 3 days. So, it was really, really cool, and that is not the only time that's happened, but that one will stick with me for a really long time.
It's so beautiful. I got chills thinking about it and what that means to like the bonding process between parent
Exactly.
and baby. It's like removing those barriers of, what we go through as humans. Like we go through a lot. We go through a lot. And so
Yes.
to be able to have practices that just keep us clear to experience the full human
Mm. Yes.
connection and all of that. It's stunning. It's so beautiful.
Yeah. This baby started smiling, At 3 months, they should be smiling already. He hadn't been smiling yet. And exactly, we as parents are just waiting. Like, that is a payment for us, right? Like, that's like remuneration is a smile from our baby. And when they don't give that often or freely, because perhaps they don't have access to that part of their brain, then that will limit their bonding experience. Or that might make the parent feel like, do I not make this baby happy? Do they not love me? Am I not giving them enough love for them? Am I not doing enough? There's a lot of not enoughness, right? When this baby is struggling. And when we can go in and just release just like release a few things here and there to allow this baby to feel good, then it takes away a lot of that doubt, that self-doubt that parents have when they're when they're especially new parenthood. But, that a lot of that blaming, self-blaming as well. Um, and the fact that we can kind of like, not completely, but a little bit wipe the slate a little bit clean is fascinating, and it changes the trajectory of this infant's life. Fascinating. I just love it.
And as you said, it's all connected. Just like all the things in our body are connected, so too are we able to behave differently, respond differently to different kinds of communication and events that might happen. Everything on all the levels of the human experience starts to shift. And it's incredibly powerful. And I hope that that mama also received some craniosacral therapy after that incredibly difficult birth. Yeah, I always think too, when we're birthing, we're in it together with that baby, it's like
Mhm.
we are sharing. There's such synchronicity and crossover between the baby's experience and the mom or the birth giver's experience. And so, yeah, to be able to have a practice that really honors both and is able to treat both and support both in that beautiful sovereignty that each of them has is incredible. Thank you so much, Meaghan. I'm so
Thank you,
impressed,
Christine.
and I think I want to take your programs because I'm clearly obsessed with this type of work and I've actually, yeah, I've really been reflecting on touch as rejuvenation and in some extra sort of potent ways at this time in my life. And I'm so appreciative of the work that you do and how you're bringing it to care providers and families. I love that you're doing both.
Thank you. I I mean, I when I'm teaching people, it feeds me. It drains me, but it feeds me. But when I'm treating people, that's when I'm fed the most. That is where I get everything back that I need. Um, because I see the changes. And I see the effect it has on families. And I don't think that anything compares to that. Nothing in my life has ever compared to that. And I have 2 kids. It's a beautiful thing.
Well, we are going to put all of Meaghan's information as well as, ways for you to dive deeper into craniosacral therapy, particularly for the sacred window and beyond. Meaghan, I'm so happy to be connected with you and all the ways that we'll continue to connect over the coming year. And thank you for being here and sharing all this with us.
Likewise, thank you so much for having me.
All right. Thanks, everyone. See you next time.
Shanti, Shanti.
The Sacred Window podcast is brought to you by the Center for Sacred Window Studies. You can visit us to find out more about our online training and mentoring programs, plus resources and products for and about the sacred postpartum window at www.sacredwindowstudies.com. And our music is written and performed by Sarah Emmett. You can hear more of Sarah's music by visiting www.sarahemmett.bandcamp.com.